welcome. You're watching our show, Health and Wellness Save a Life. Well, life is valuable and precious. Being able to revive a person's heart to save their life will provide one with immense satisfaction. It's sad but true fact that the number of people dying from cardiovascular disease is steadily rising in India. Most of these cardiac deaths are sudden and on the spot. It is possible to prevent these sudden cardiac deaths if they receive immediate medical attention and CPR. The recent incidences of some celebrities collapsing suddenly and passing away due to a heart attack are concerning and shocking. There's an alarming rise in the number of young patients with heart attacks and sudden cardiac arrest. What is equally scary is that sudden cardiac deaths may happen in people who have no known history of heart disease. The risk is higher for patients with existing heart disease, and in almost every family, we have at least one family member with heart disease. Can one make himself or herself capable enough to save a life in an emergency situation? Yes, it is possible if you're well trained in CPR. Many adults in cardiac arrest can be revived with intact neurological function if the bystanders can provide immediate CPR. Raising public awareness and understanding of the practical application of CPR is an essential strategy to increase the success rate of CPR in cardiac arrest cases. Save a Life is an initiative through which people will be aware of the early signs and symptoms of cardiac arrest, train them on CPR, and highlight the role of CPR in saving a life. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. Let's go on with our guests now. We have Dr. Anil Balachandran, Consultant Interventional Cardiologist, Lakshmi Hospital in Kochi. We also have Dr. Amit Vilas Joshi, Consultant and Interventional Cardiologist, Jeevan Jyoti Heart Center. This is the Heart Care Center in Miraj. And Dr. A. Vasanta Kumar, Interventional Cardiologist from Sri Vijay Durga Cardiac Center in Kurnool. Well, thank you so much, doctors, for joining us on the broadcast today. Let me take my first question. That is, the term cardiovascular disease often induces fear as cardiovascular diseases are the leading cause of death globally. What exactly is cardiovascular disease? Does it mean a heart attack? Let me take this question to Dr. Balachandran.
Thank you, Divya, for the nice words of introduction, which covered each and every aspect of the importance of this topic per se. For the general public, cardiovascular disease is akin to heart attack because it is the most common thing, and the risk of untreated heart attack leading to death is very high. But the spectrum of cardiovascular diseases are much more than that. We all know that heart is a muscular organ which pumps blood to all parts of the body. So, the heart is being supplied by blood vessels which supply the nutrients to the muscles. So, if there is a block in that blood vessels, that results in heart attack per se. In addition to that, I told you that heart is a muscular organ. If there is a deficiency in the pumping function of the heart, we call it heart failure. The heart beats in a rhythm. The rhythm is called the heartbeat, and that is in the tune of around 60 to 100 beats per minute. So if there is a disturbance in the rhythm, we call it arrhythmia. That is another spectrum of heart diseases per se. There are certain valves to control the flow of blood into and away from the heart. So if these valves develop obstruction or leak, that results in a spectrum of diseases called as valvular heart diseases. In addition to that, there can be certain diseases which are present from birth, that is by birth. We call them as congenital heart diseases. So these are the various spectrum of cardiovascular diseases in a nutshell. But for all practical purposes, for the common man, cardiovascular diseases amount to coronary artery disease or the so-called heart attack, because the incidence of heart attacks are much high in the general population. And I would also ascertain the importance of heart failure also, which is coming up in a big way in the general population.
Right. Thank you for answering all those questions. Now, while not all heart problems have the same symptoms as depicted in movies, certain indications are worth noting and scheduling a doctor's appointment. How does someone know if he or she has a heart problem? Let me take this question to Dr. Joshi.
Yeah, basically now there is a rise in the incidences of heart attack. So, which everybody should know, there are different symptoms which can lead to a heart problem. It is not typical like only left-sided chest pain which can lead to the heart attack. There can be various other symptoms. First of all, there can be a extreme fatigue that can also a sign of your heart that we have maybe having some blockages or there is an early sign of heart failure. The second thing is shortness of breath. If you are experiencing shortness of breath while having less than accustomed work, that if you are walking around 5 kilometers a day and if you are now facing fatigability at around 2 kilometers, that can be an early symptom that you can have a blockages in your coronaries. The other signs are like you can have some dizziness or you can have a lightheadedness. There can be some irregularity of the heartbeat, palpitations that can also be a symptom of the heart. Also, you should look at the lower limb swelling. So the patient can have bilateral lower limb edema that can a sign of a heart failure, and you should go to the doctor, seek his advice and do a 2D echo to assess the functionality of the heart. Also, the typical chest pain is not there. Sometimes only the squeezing in the heart, or sometimes you can have lightheadedness and only having the extreme fatigability, which can lead to the symptoms of the heart problem. So these are the symptoms which you should especially look for and have the diagnosis of the heart disease confirmed with your doctor.
Right. My next question is for Dr. Kumar. Doctor, the atrial fibrillation is the most frequent cardiac arrhythmia. What happens when the heart during atrial fibrillation? What really happens? If you could explain that to us, Dr. Kumar.
Good afternoon. The atrial fibrillation is a rhythm disorder where the lower chambers of the heart, the atrial chambers of the heart, doesn't contract properly. It should contract around 60 to 70. Instead of that, it contracts around 400 times. And it should effectively propel the blood into the ventricles and into the circulation. Because of the ineffective contraction during atrial fibrillation, the blood gets pulled up in the atria and it gets clotted. And these clots will go to the circulation either in the brain, heart, or limbs, giving rise to complications. Not only this, at this heart rate, if the heart starts contracting, it loses its pumping capacity. So they go into heart failure.
Right, Doctor, thank you so much for that answer. Let's also talk about which group of people has the highest risk of developing atrial fibrillation. What are the most common complications of atrial fibrillation? If Dr. Balachandran could take that question.
As rightly pointed out, atrial fibrillation is one of the most common arrhythmias seen all over the world. As the term suggests, it is called an arrhythmia, that is out of rhythm. So here, who is at more risk of atrial fibrillation? The first thing, let us look at the common things first. As we blissfully age, our conduction system of the heart also ages. So advanced age is one of the most important risk factors for atrial fibrillation. The second thing, which is more common, at least a good proportion of us are hypertensive or high blood pressure. So high blood pressure, if not treated in time, can result in atrial fibrillation. Third thing, coronary artery disease, or for the common man, heart attacks, may be associated with atrial fibrillation. So the presence of a block in any of the arteries can result in an atrial fibrillation per se. And as I rightly pointed out, atrial fibrillation can occur along with heart failure when the chambers are dilated. Atrial fibrillation can occur along with valvular heart diseases also. In addition to that, in something related to your lifestyle, which is not very uncommon, that is, if you have a binge of alcohol, that can result in atrial fibrillation per se. So these are the common conditions which can predispose to atrial fibrillation. And what is the risk of atrial fibrillation? So when the heart is not beating in rhythm, the pumping is not taking place in the proper way, it is arrhythmic. So when there is a lot of loss of rhythm, there is a chance of blood getting clotted within the heart. So when there is a blood clot within the heart, when the heart pumps blood the next time, this clot can reach anywhere in the body. Most commonly, if it reaches the brain, that results in a stroke or cerebrovascular accident. If it reaches any of our peripheries, that can result in lack or cutoff of blood supply to that particular part, resulting in a gangrene or loss of that particular limb. So that is one of the dreaded complications of atrial fibrillation. So that's why it is important to know about this condition and to recognize the particular complications of atrial fibrillation, which may be life-threatening or disabling.
Right, talking about complications of atrial fibrillation, can atrial fibrillation cause sudden cardiac death? Let me take this to Dr. Joshi.
Yes, atrial fibrillation is generally associated with other comorbid conditions like stroke, as well as there is a higher mortality of having the heart failure. So the patient can have stroke, heart failure, increased risk and repeated admissions because of the atrial fibrillation. So it should be completely restored to the normal sinus rhythm or kept in control. The second thing is with the atrial fibrillation, there is a risk of sudden cardiac death which is increased to 2 to 2.5 folds as compared to the normal population. So the patient should be made aware that it should be considered as risk factor and taken proper advice with the doctor to take rate controlling medication as well as the anticoagulant medication to prevent the stroke. Also, it can lead to ventricular fibrillation and ventricular tachycardia, which can lead to a sudden cardiac death. So yes, stroke is a dangerous condition. You should be made aware of it and should be kept controlled. At least the rhythm should be restored or the rate should be controlled in those populations.
Right, let's talk about CPR now. CPR is a life-saving technique. If Dr. Kumar could break it down for us, exactly what happens when CPR is performed. Dr. Kumar.
Yes. So when you are performing cardiopulmonary resuscitation, the first thing we should do is good compressions. So the front of the chest, you compress such a way that the heart pumping, which it's not occurring, by your compression, you are ejecting out the blood into the blood vessels. And your circulation should take care of the brain circulation, heart circulation, which are the most important organs. When you are doing compressions, for every 30 compressions, we should give 2 breaths if you are trained well for this. If not, or you are a single person, you are not able to do the CPR, then you do just compressions till you get the help from others. So each compression, the chest should, front of the chest, from the front of the chest, it should compress such a way that it should go down by 5 centimeters. You should not break the ribs and other things. So front bone on the sternum, you keep your the hands and use your weight to compress give the compressions. So give from 100 to 120 per minute, and for every 30 beats, you give 2 breaths. So this cycle should be repeated 5 times in 2 minutes. So every 2 minutes, you check whether the pulse has appeared or not, or whether the consciousness is not appeared or not. Then you again start compressing and get help to give any implantable defibrillators are available, AEDs. Then we can take the help of these people till you get paramedical people. So this can be done by anybody.
Right. So we're talking about performing CPR. When should one not perform CPR? We'll talk about that after a very short break. Lots more coming up on the other side. Stay with us. Welcome back. We have Dr. Balachandran, Dr. Joshi and Dr. Kumar back with us. Before the break, we were talking about how and when to perform CPR. But let me take my next question to Dr. Balachandran about when not to perform CPR. Though your intentions might be correct or wrong, or half knowledge can be dangerous, when should one not be performing CPR? Dr. Balachandran.
Divya, before going to the answer per se, I would like to make a statement that CPR or cardiopulmonary resuscitation should be a skill which should be imparted right from the school level to almost everyone, because that is one thing, the difference that you make is between life and death for a person. Having said that, doing CPR, whenever we learn a new technique, it is equally important to know when not to do a technique. CPR is done in cases of cardiac arrest. Cardiac arrest means heart ceases to function as a pump. So how do we know that the person has suffered a cardiac arrest? First, confirm a cardiac arrest. How can you confirm a cardiac arrest? The person would be unresponsive and not breathing. So confirm a cardiac arrest before giving a CPR. There is no point in giving CPR to a person who is breathing well, who is unresponsive. There is no point in giving CPR to an awake person. Imagine someone just sitting on your chest and giving compressions. This is one of the most unpleasant and painful situations. So always confirm a cardiac arrest before giving a CPR. Second is also as important as the first point, that is, the person who is giving CPR should make sure that he is doing CPR in a safe environment for himself. So never try to attempt CPR amidst a fire or near a flood or flooded area or in the middle of the road, because you may have to find out someone to do a CPR for yourself. So do CPR only in a safe environment, both for the patient as well as the care provider. And when to stop CPR, that's also very important, because once an unresponsive person and you have started CPR for him, once the person starts breathing and the person regains consciousness, stop CPR. The other situation in which, when you have the presence of a trained medical personnel, stop CPR and hand over the victim to that person who is much more experienced than you in reviving the patient. And if you have the presence of an automated external defibrillator, that is one thing which is present in almost most of the public places as well as malls. And if you have a person who knows how to operate that AED, you can try stopping the CPR and trying the AED once. So these are the situations where you should be very cautious about not doing the CPR, and you should be very cautious about when to stop a CPR per se.
Right, Dr. Balachandran spoke about AED. Let me take the question to Dr. Joshi now. How does an automatic external defibrillator or an AED help a person who is in cardiac arrest? Doctor.
The automated external defibrillator, it generally, when it is connected, it automatically analyzes the rhythm, whether the patient is having the ventricular fibrillation or tachycardia, and then it tries to analyze the rhythm and give the shock when it is appropriate, so that they will have the restoration to the normal sinus rhythm. The patient generally have the different kind of chaos rhythm which can restore to the normal sinus rhythm once it is shocked. So it is very important that once the AED is available, you should appropriately attach it. It generally has the accessories like batteries and paddles, so that you can attach it and restore the rhythm to normal sinus rhythm. Generally, the AED is there at the crowded places like railway stations or marketplaces or bus stations. So there is actually, it is very easy to use machine, but generally it is recommended that you should have the basic knowledge or how to give the connect the AED and give the shock. So I recommend that there should be some basic training in the CPR as well as use of AED to the general public, and it should be made aware in the college itself, so that the people should be saved once they have CPR is given and the cardiac arrest can be resuscitated very early. So the mortality is less.
Right. Dr. Kumar, a heart attack or a sudden cardiac arrest is more likely to occur in people with existing heart problems or with diabetes. What information should they be carrying with them while going out? Dr. Kumar.
Yeah, they should take the permission of their cardiologist or a physician before they take a trip or a trek, anything of that sort. And they should take their tablets regularly. Then they should have a ID card with what medication they are taking and the cardiologist number probably. And most of the times, most the patients they avoid taking drugs before a trip because if they are taking certain drugs which can increase urination, they have to use washroom and which are not available during the journey, and they stop tablets and they go into heart failure and pulmonary edema. All these problems can occur. So they should have proper medication. They should take it properly. Suppose you take insulin and you're not taking breakfast at that moment and you delay it, you go into hypoglycemia. This hypoglycemia can cause arrhythmias and cardiac arrest. Similarly, they should have adequate stock of his. Even if he's going for 2 days, he should take the drugs for 5 days because you don't know what's going to happen. So they should stock these drugs regularly. And if you're going to take a journey to hills or high altitude or a pilgrimage where you have to climb stairs and all these things, you better go to a cardiologist, a physician, have a ECG, check up blood pressure, and probably have an echocardiogram or treadmill test so that they can assure you that you can undertake this journey, especially going to Manas Sarovar or Everest Base Camp. All these things, you need to know what disease you have or what probability you have for sudden cardiac deaths.
Right. Thank you so much, Doctor, for answering my question. Also, thanks to Dr. Joshi and Dr. Kumar for joining us on the broadcast this afternoon. Well, thank you very much. Also to our viewers, thank you so much for your time.